Good afternoon. I'm the last speaker, hope not the least. And कितना भी senior हो जाऊँ सर के सामने बोलने में अभी भी थोड़ी सी हिचकिचाहट होती है. Anyways, so I'll be talking about a totally separate issue actually, what has been discussed up till now. I'll be talking about the molecular and genetic level markers for early diabetic retinopathy changes, probably creating new hopes. We all know that diabetic retinopathy has become a menace, a catastrophe of sort, with millions and crores affected worldwide, and India is definitely the world capital of it. There is a huge shortage of retina specialists, as we all know. I think yesterday I was checking, we have only 1,000 VRSI members up till now, probably catering to a population of crore, especially in the periphery. Or I did a research also. There I found that the rural population is having more diabetic retinopathy than the urban population because they're neglected actually. Anyways, so in our armamentarium of diagnosing and treating diabetic retinopathy, we have just now we discussed so many things. We have got all sorts of latest instruments, all sorts of latest therapies. We talked about new anti-VEGFs. Many more are going to come. But what is the need of the hour? 1,000 retina doctor gang, can we control this menace of diabetic retinopathy? Or will our country go blind? So we have to think something different from what we are already doing. So the need of the hour is to reduce the cost for diagnosis and treatment of a country like ours, where there is a lack of resources. And now we should focus on some other modifying factors at the genetic, molecular, hormonal, or lifestyle modifying things, which especially the lifestyle modifying factors. So basically, I would like to share few of my researches, and I think I will give all credit to my PGs. Many of them are sitting over here. Before that, we all know what is genomic biomarkers. Genetic biomarkers are the one which predispose individuals to a particular disease, say for this case, diabetic retinopathy, which could either lead to prevention or slow the process. And by genetic editing techniques like CRISPR technique, as this chart shows, we can catch hold of that marker, that area, and probably we can rectify the gene. A diabetic person may have diabetes but will not develop diabetic retinopathy. So some of the researches which we have done in our institute, I would like to share, and those are all on the molecular or genetic or hormonal basis. This research got the best award also last year. It showed a positive association. We did a genetic polymorphism study by GNA polymerase, and we did all sorts of this RNFLs and all. We found that minus 374 TA polymorphism is associated with diabetic retinopathy. Probably in the future, if we do by CRISPR technology a genetic engineering and remove this polymorphism, probably the incidence of diabetic retinopathy may come down. Okay. Another study showed that estrogen had a protective effect up to menopause age. After menopause age, after the age of menopause, after that age, we have to give, or we should give estrogen dose, otherwise the incidence of diabetic retinopathy is more. Okay. Again, with thyroid also we saw that hypothyroidism is associated, because both are autoimmune diseases. So hypothyroidism is associated with more incidence of diabetic retinopathy. Therefore, in my protocol, now all cases of diabetic retinopathy I am sending for a thyroid evaluation regularly nowadays. Same with serum cortisol, we saw higher serum cortisol associated with diabetic retinopathy and lower prolactin associated with higher incidence of diabetic retinopathy. Again, hypocalcemia was associated with diabetic retinopathy. We have to give calcium supplements. These are some of the other studies which are ongoing. These are some insulin growth factors and inflammatory marker like HRBP. This is a very interesting study about brain-derived neurotrophic factor. As we all know, BDNF is a neuroprotective agent which decreases levels in neurodegenerative disease, and diabetes is both causing neuropathy as well as vasculopathy. Okay. So BDNF level, we have seen that it is lower in cases of diabetic retinopathy. So it is causing neuropathy, and I'm afraid that probably in the near future I will be working on dementia and diabetic retinopathy, and we will find the level of BDNF. One of the work we are doing on epigenetics. Epigenetics is basically disease modifying. We don't change the genes, but factors which change the genes quality basically. So we are working on DNA methylation study, which is affecting the mitochondrial dysfunction. Another study, these are inflammatory markers. One is transforming growth factor beta 1 and another is ICAM. Both these are ongoing studies. Probably in the near future, we'll rely more on deep learning, artificial intelligence, and probably deep learning can tell us, we can have a fundus photograph of a DR patient, and it will tell that after 5 years or 10 years, you will have this stage of diabetic retinopathy. Modify it, otherwise you are going to get blind. We all know the role of telemedicine and wearable technology for monitoring, which can basically 24 hours can give you a feedback of your blood sugar level or something like that. Latest anti-VEGF, nanotechnology based or sustained release implants, stem cell therapy, which can reverse the effect of diabetic retinopathy, probably. These are latest stem cell therapies, and it does work in early and moderate, but not in the advanced stage. Nowadays, stress is that diabetic retinopathy, one of the main causes mitochondrial dysfunction. So either we treat the mitochondrial health by giving antioxidant therapy or some antimitochondrial energy giving things, probably. Another very interesting thing I saw was the role of microbiome and so the gut and retina relation. It showed that there are some probiotics and prebiotics, and they are associated with higher incidence of diabetic retinopathy. So probably if we have a good healthy GIT, with good diet and good healthy lifestyle, probably it also affects diabetic retinopathy. It's a research or thought to in the near future to work on. Okay. And last but not the least, I always stress, change your daily behavior, reduce your stress, change your diets, do yoga, do adjuvant therapy, be stress free, and that has a lot of bearing on your diabetic retinopathy also. The future of diabetic retinopathy treatment lies not only in the cutting edge technology, but in our commitment to early intervention, patient education, and collaborative care. Together, we can protect vision and enhance life. Thank you.
Thank you, Dr. Waris. I think great concept. We need to work more on these things to find the genetic biomarker and target them at an early stage, and we should have so many things coming up which might help us to tackle this kind of a problem, which we in fact are treating all the complications, and if we tackle it before those things happen, that will be great. So I think your presentation is very well taken on that behalf.
Just a basic thing I just wanted. So are these biomarkers and genetic markers, are these for diabetic retinopathy or for diabetes? So these are basic. No, like what we are trying to do, are we going to treat diabetes, or these are biomarkers for diabetic retinopathy in cases of diabetes? No, what I'm trying to say you is, like, if we are able to find some biomarker or a genetic marker for diabetes, then might be that we are going to treat diabetes as such. Yeah, then even nephropathy and neuropathy and other things, all those things can be taken care of. So that's what I was just wondering. No, because we do see a lot of variations in diabetic retinopathy. Some people get very florid diabetic retinopathy at a very early stage, and some people don't get it even till long, even till 30 years. And with good control or without good control, I think some families, they will get very soon and some may not get it. So I'm sure there is something else going on in addition to hyperglycemia. But what I am trying to just ask you is, if these biomarkers can be for diabetes, then maybe we are treating the disease itself. Because as of now, we are treating the effects of the disease. Thanks. Thank you.